Welcome to Another Dose, the GEMS podcast where EMS meets ED to talk about trending topics in emergency medical services. I'm Dr. Candace McDonald.
I'm Robin Goldinger, and today's show is focused on personal preparedness among EMS professionals.
We know that our EMS first responders have a huge heart for helping others, but sometimes they fail to prepare themselves and their families for those emergencies.
EMS personnel working inside and outside of the hospital setting have a personal responsibility to provide essential services during times of disaster. So the current pandemic is one example of for first responders across the country responding to the emergency needs of the community and not being able to take care of their families at home. They're isolated.
So in order to effectively meet the needs of the community during times of needs and disaster, our EMS professionals really need to take the steps in advance to prepare themselves and to prepare their families. Just like we encourage every other citizen to do, we need to take our own advice and prepare. Let's take a look at the research and what the research says and the surveys say about just how prepared our first responders are personally in the event of a disaster and how it can impact our workforce. So let's look at the statistic first. These statistics, I might add, come from a variety of different studies. So they're not just from a single study. They're pulled from different studies. Number one, 48% of first responders responded that if there was a multi-day event, that it would create issues and hardships for their family. 48%, that's almost half. Only 18% reported that they had an individual or family preparedness plan in place. 55 to 66% indicated that they would actually refuse going into work and responding to a call in the event of a national disaster that was outlined by a national planning scenario. 55 to 66%, that's a huge number. 73 to 91% believed that their city and or their department was not prepared in the event of a disaster, and they had concerns about that. Only 34% of the departments that these people represented had reported that their organizations had taken steps to prepare themselves and their families for an implication of a multi-day disaster. That's those numbers that they tell a big story. But there's some good news. So the potential solutions tied to these studies showed that our first responders, they're willing to learn, they're willing to adapt, and they're willing to do what it takes to address this issue. So 96% indicated that they would participate in individual or family preparedness planning. So that's a big number. 96% said they'd be willing to do it if their agency offered it. 78% agreed that the existence of such a program would positively affect their family and their willingness to respond to an incident. So that's important to know. 72 to 82% said that the establishment of shelters for employees and their families would be helpful and would help them to respond.
So without taking the appropriate steps to prepare themselves and their families, our EMS professionals would struggle with performing on their jobs during any kind of disaster. And they might be more focused on the safety and needs of their families versus the community. So the things that we do in the hospital setting are kind of advanced planning and education between the ED staff and EMS staff. It's critical to ensure that our professionals can provide their full focus to meeting the needs of the community during a disaster.
Yeah, absolutely. So today's show will include two very special guests to answer the question, what can you do as an individual? And the other question, what can you do as an organization to be prepared for the next disaster? So with us today, we have Tiger Schmittendorf. He has served as the Erie County Department of Homeland Security and Emergency Services in Buffalo, New York for more than 20 years. He's finally retired, but I see more of him now that he's retired than I did when he worked. But he's also a firefighter and a longtime instructor. He has traveled the country sharing his knowledge with other fire and EMS service organizations. So he'll be joining us a little bit later.
We also have with us Dr. Alan Turner. Hi. He is a special agent and the emergency manager at NASA Glenn Research Center. Dr. Turner previously served as a preparedness specialist for the Department of Homeland Security, where he coordinated vital Homeland Security preparedness training and response initiatives for federal, state, and local emergency responders for 8 states and over 1,500 miles of international border throughout the Great Lakes region. Dr. Turner is a 23-year veteran of the U.S. Coast Guard. and has worked as a responder and response manager for oil and hazardous material releases, national disasters, how about natural disasters, hurricane planning and response, and maritime law enforcement and mass rescue operations.
So we're super lucky to have both of these seasoned professionals with us today. So we'll go ahead and we'll get started with Dr. Turner. So Dr. Turner, we know that you've worked all over the country as a responder and response manager for some of America's greatest disasters. You know, some of our listeners, they've never had to experience a disaster. They've been very lucky to not be in one of those regions that's been impacted. Can you share with our listeners some of the things that you've observed or witnessed among first responders during disasters?
I think the biggest thing is that responders, when they go out, they're mentally prepared for what they're going to see. They can, between death, injury, natural disasters, just response, working with others. The problem is a lot of times you don't capture what their family concerns are. You don't understand, or you may not understand what they're going on, what's happening at home. Are they going to be impacted by the disaster that you're responding to? Are there there's different family concerns, such as either a death in the family or your family just needing food and shelter, where they're going to be during the disaster, where you're going. And, do they know what to do if something happens to your house? The gas, the shutoffs, the electrical, and also the threats in your area.
Yeah, absolutely. And I know, you responded to Katrina when that occurred. And I don't know if you want to share for the folks that responded to that, how long were they away from their families? I mean,
usually they go out for 21 days. And that was a phone call. Basically have your bags ready to go, and then they go out. Katrina and then Rita came right after that, so they even brought more people in after Rita. So it is difficult, and especially one of the things that I really noticed is that in after action and corrective actions, this isn't captured. You don't capture this in your, because it's personal to you. People really don't share that, hey, my wife had a really hard time with the 3 kids running around in diapers, or they had to evacuate while I was deployed.
Yeah, absolutely. And if you have somebody who's a single parent or somebody that cares for an elderly parent, that becomes even more challenging.
Exactly.
Yeah. So what advice do you have for our EMS professionals listening on ways that they can prepare themselves and their families should this occur in their area?
I think it's the common sense stuff, the risk that are around your neighborhood. If you live in a water area that's prone to flooding, if you live in a, if it's earthquake season, that, there's a high chance of probability of earthquakes, tornadoes, all through that, the different types of disasters. One of the biggest things that we've seen in helping and responding is the lack of people that are insured. The flood insurance is different than homeowners insurance. People who've paid off their homes, they don't necessarily keep up with the insurances. How many people can put their hands on $1,000 right now to help mitigate anything they have going on? I just going to the store recently, the one place I go stopped taking credit cards.
Oh, wow.
And another
Really?
stopped taking money because they don't have any change to give. So you got to either have the exact amount or, so it just, there's different contingencies that you just got to be mindful, whether it's a hurricane, a tornado, or your neighbor digging in the backyard and he cuts your gas line.
Mm-hmm.
So, and I think, you and I've talked before is that, in the event of a disaster, your community can change, the response needs can change. And I know before we started the podcast, we were talking about your experience in Minnesota and a new threat that happened during a flood. And I don't know if you want to share that with the listeners, because I think that's something, sometimes we get into that same routine of, okay, we're going to respond. Here's the threats that we need to worry about. And we forget that in times of disaster, our whole environment can change.
Mm-hmm.
It was the floods. I want to say it was 2012 maybe, and you can check this, but they had major storm damage up there. It was, I want to say it was August, and but the zoo flooded and the seals got out. The polar bears saw the seals getting out, and the polar bears got out trying to chase the seals. So it was one of those things. Fortunately, I went to the EOC, and I didn't really have to deal with it. But when you see them tracking it in the EOC and tracking the different animals that got out of the zoo, that's something that you're really not prepared for.
Yeah, so as an EMS professional, you're out there trying to respond to somebody's house to meet their medical needs, and you have to worry about getting eaten by a polar bear. So.
Well, it's Minnesota.
That's so weird.
Yeah.
They're hardy people up there. God bless them.
Yeah. So one of the other things, and Robin, you may be able to help answer this. One of the things that I've seen as an EMS professional is that a lot of times people don't prepare as far as medicine, and they think that they may not have their daily meds, and if there's a disaster, they can just go to the ER and get those meds. But that's not as easy to do that.
No, you can't just go to the ER. We don't have all of those home medications stocked in our department. We do have pharmacy on site that can help to dispense some of those, but it's not nearly enough to help the whole community. So, these community members really need to be active in taking their part and making sure they are ready at home with their medications, with some extra food, with bottled water, just in case.
Yeah, and just like in our first responders, our EMS professionals need to do the same, where sometimes the worst ones, it's waiting to the last minute to get refills on those key medications and having that medication list. So I think it's important that we do our part as well, so we don't become part of the problem in the event of the disaster. So Alan, I got another question for you. I know from working with you that you are super big into organizational planning and continuity planning. So what advice do you have for EMS leaders on what they should do to prepare their EMS organization for the next disaster should, something occur?
One of the things that I've always learned, and especially in the Coast Guard, you do objective planning, not so much scenario planning, because you just look at 2020, where you had a global pandemic, economic collapse, supply chain issues, civil unrest, protests, riots, California earthquake, 8 tropical storms, European windstorms, murder hornets, and of course a massive asteroid. So if somebody's able to plan all that in 6 months, they're much better than I am. So I would say the best thing is, one, know your hazards in the area. If you live by a freeway, like I said, if a body of water or anything that could cause damage to your home, and then know your surrounding, know the stores, your schools. Obviously now you look at the pandemic, opening up schools is a big deal because it gives the families where they can send their kids safely. And then I would say that the biggest thing, and this is one of the biggest things that I've learned from the Coast Guard, is don't become a victim. Maintain your basic needs, don't become a victim. And I mean, don't become a victim both physically and mentally. So get both those checked out and make sure that, you don't get involved or create more of an incident that needs to be because you're not prepared.
Yeah, absolutely. And would it, sometimes I don't see, especially our private EMS, I don't see them getting involved in the large scale functional exercises. How valuable is it for EMS organizations to participate in functional exercises and tabletop to prepare for a disaster and prepare their people?
Oh, I think it's vital, because not only it helps you to learn, but it also helps you to learn what other people are doing, what the other agencies are doing. That's why when we do our exercise, we try to call everybody in that support us on a daily basis or support the other fire departments, or they back them up on a daily basis. So it just helps with that communication, putting a name with the face, getting on and familiarization.
So, and one of the things that, I remember when I started working with you 6 years ago, I remember you saying and looking at some of the disasters and projecting them that, concern that you had was a pandemic. And I remember when you planned the pandemic exercise, making sure, and you had the CDC, and you had all those key partners there and being able to collaborate. And so now you established all those relationships in advance.
It was good. And it also helps that the CDC doesn't regulate NASA. So I had no problem opening the doors and bringing them in. If I was an administrator, I may do something a little different. But HHS and, the CDC, they were awesome. Everything that I thought I was doing right, they would just come up and whisper in my ear and say, if you adjust this way, if you could do this way, and then adjust your plan accordingly. And they were invaluable. And they came up, they worked with us, they reviewed my plan, and they sat there through the entire exercise, just kind of tapping you on the shoulder and, kind of adjusting different things. So that was really good. It's kind of hard to pull off a pandemic plan because, one, you got to create like a massively fake scenario, almost like on the border of zombies attacking us. So it was difficult pulling it off, but I want to thank the center for trusting us by pulling that off, and then having the CDC, HHS, and even the public health from Mercyhurst University came up and observed and actually evaluated from a public health standpoint of the new students coming in and getting them kind of a leg up in closed pod and pandemic planning.
So, Alan, you brought up a really key point that some leaders struggle with. One of the things that I heard you just say is that to be willing to accept feedback, be willing to hear the things that you're not doing quite right or that you could adjust to do better. And not every leader is always open to that. How important is that to success and being able to listen and being open to feedback?
You gotta take your pride out of it. I don't know everything. And like I said, the more I go to, the more it's eye-opening, and just how different responds. And we're talking about the different basically the generational management of this, and how different the millennials think. And I'll be honest with you, I love how they think. Look what we're doing now. We're teleworking. We're big push from their end. So I really do. I really enjoy it. And plus, I got 2 millennial kids that will probably listen to this. So,
and your daughter's doing some really cool stuff. So
she goes to Johns Hopkins for public health. So I have to listen to her.
Yeah.
But, no, it's but I think taking feedback, and especially how it's presented. I didn't take it as I didn't take it personal. I didn't take it, I took it as they were actually trying to help me, and they were. So,
yeah, feedback is so important as you're developing your plan to be prepared and prepare your staff. Gaining some feedback from those outside evaluators, those outside eyes can be very, very helpful.
And
we do a little bit of disaster drills and planning in the hospital, and it's kind of coordinated with the other hospitals around us as well. So we all have this story that, pops up on a TV screen that it's a breaking news, and they have, there was an accident involving 7 school buses and la, 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 and it gives you certain scenarios that you have to kind of pull together as your team leaders and delegate to people. And every year we do a different lead. You're a different role. So you kind of respect what everyone else is doing and everyone else brings to the table, and just the minds coming together to figure it out. It's really cool.
And Candace, you brought up a good point, because the emergency management plan is different than continuity plan. Emergency is you're running into the disaster, and continuity, you're stepping back from the disaster and setting up operations. So the pandemic, in reality, it's both. You're responding to the pandemic, but you're stepping back away from it to do your actual work, because we're not deeply involved with the pandemic, but we're affected by it because now we're all working from home.
Right.
And
Mhm.
sometimes that's hard to explain to leadership. We're fortunate that we have the leadership that does buy in, but I've worked with people, and if you can understand this analogy, and when I talk to this person who outranked me by several ranks, he's like, you have to convince me for continuity planning. If I drive my motorcycle at 100 miles an hour every day, why should I worry about my cholesterol? So basically, he's constantly putting out fires, doing all little things, but he's got to step back and look at the actual continuity as if, you know, we're going to have to relocate, or 30% of the staff is going to be sick. But every day he's got operational commitments to achieve. And so, yeah, it's a sales pitch. And if you work for the government, you got to be a salesperson. So,
And I think we know with the pandemic, like right now, that if somebody tests positive, that for COVID, they could wipe out their entire EMS organization.
yeah,
Everybody can end up isolated, everybody can end up sick, and even the same thing, Robin, with you in the ER. And so it's important to know, what is your backup plan? How are you still going to continue to serve the public? In addition, as we talk about this and looking at that, we still have to go back to thinking about the EMS professionals and what they have going on at home. How we as leaders can make sure that our folks are taken care at home, and that they've done what they needed to do in advance to make sure that the crisis isn't growing and the anxiety isn't growing, because they know things at home are not taken care of.
Mhm.
So, yeah.
Absolutely.
Well, Alan, we'd like to thank you for sharing. We really appreciate you joining us, and we'll give you an opportunity to share some final words in a little bit.
okay, great.
Thank you, Alan.
Thank you.
We'd like to now welcome Tiger to the discussion. Tiger, as a county employee and a volunteer firefighter, what have been some of your experiences with disaster preparedness, or the lack of preparedness?
Well, first, for clarification, former, aka retired county employee. Praise the Lord.
Oh, sorry. I know that's important.
Best decision I ever made. But I see it on so many different levels. There's a personal level, and there's a professional level. There's an organizational level to all of this. I think at the kind of the core of the challenges that we face in fire, emergency medical services, emergency management, public safety overall. One, we are problem solvers by trade, right?
Mhm.
That's what we do. A phrase I use in the fire service is, when we're faced with a challenge, we throw the kitchen sink at it. And when we run out of kitchen sinks, we simply call for more kitchen sinks.
Mhm.
And that's our nature. But managing our personal lives during a local or regional, statewide, or even national emergency, we're not as good at that as taking care of people laying in the street, so to speak. And the reality is that we're much better at taking care of the people we serve than sometimes we are the people we serve with or serve for. So
Mhm.
that means each other as fellow responders, but also the people we serve for, or as I say, the people who allow us to serve, is our support system back at home. The other challenge, kind of on a larger
Sorry.
scale, that's a, on a larger scale, is that when you look at fire and emergency medical services, we are great at starting and stopping sprints, but we are not necessarily in it for the long haul, the marathon that some of these disasters and large scale emergencies turn into. So we have it could be everything from attention deficit, so to speak, because the first emergency is over, and now we're into the recovery mode, or sometimes just the documentation that has to come with it. So those are real challenges that kind of affect us as a culture, as responders. So, my personal experience with some of the emergencies that I've had the opportunity to respond to, both as a local responder on the county level, and also as part of a regional incident management team. Organizationally, we need to get back to a first family first focus. And when we do that, we will actually end up with more productive and more sustainable workforce for first responders. One of the key phrases I use as it relates to volunteer fire and EMS recruitment is peace at home equals peace at the firehouse. Well, that's never more true than when we're in the middle of an emergency, right? And as a responder, if I'm carrying the weight and the stress of worrying about my family while I'm gone, that's going to weigh on me. It's going to affect my, physical performance. It's going to affect my mental performance. It can literally affect situational awareness, and it can affect outcomes, literally life and death. But also from the family standpoint, a lot of their stressors come from just the fear of the unknown of what we are going into. And it may not be physical risk that is the concern. It could be mental risk. I've responded to a couple of hurricanes here in New York State. In the middle of one of them, Hurricane Sandy, I was deployed to Long Island. My then 20-year-old son got in a horrific auto accident where he went through a telephone pole with one side of his car and knocked down a tree with the other, and was found standing outside his vehicle at the bottom of an embankment with his overturned car covered from head to toe in glass, blood, and gasoline with a live power line down around him.
Oh my goodness.
So I got that phone call, woken up out of a dead sleep in a firehouse in Syosset, Long Island, at about 4 o'clock in the morning, and immediately woke some others and made plans to, get on a plane, fly home immediately. Before I could even do that, my wife called back and said, "Don't bother, they're not going to keep him," because he wasn't severely injured. He literally walked away from that accident. But imagine the stress that put on me. Imagine the stress that it put on my wife to have to deal with that entire situation on her own in my absence. And Candace and my wife, Lori, are great friends, so she knows the context of that. But, and that's one situation where it stressed everybody out. Another incident that I relate with my wife, and Candace knows she's just about perfected grounding me when necessary, both physically and mentally. But I was the countywide incident commander for the recovery from the crash of Continental Flight 3407 on February 12th, 2009. Where 49 people on the plane and 1 on the ground were unfortunately perished in that incident. And it occurred at about 10:30 on a Thursday night. I didn't get home until for the first time until about midnight on Friday. Was back in the emergency operations center at 5 o'clock in the morning, and she got on a plane that day, which happened to be Valentine's Day, to fly to Wisconsin to see her sister.
Wow.
Imagine the stress and the emotion. The baggage she was literally carrying with her as she got on that plane. And in a moment of intended heroism, I used my credentials at the airport to bypass security, go right to the gate in hopes of kissing her goodbye. And as luck would have it, the plane boarded about 5 minutes early. So being the everlasting or hopeless romantic, I texted her, that I loved her and missed her already. But, I just felt like I had blown it at that point. And so that was a lot of stress that I carried with me. And the following morning, I actually that evening I went home, and she had left a note on the kitchen table for my son Alex and I. And I have it pinned to my bulletin board in our emergency operations center where I worked, and now I have it here. And it said, "Please feed the cats, give them water, and clean the litter box." And underneath it, she wrote, "And do the same for yourselves."
Aww.
And what she was talking about was this litter box, because she knew what I would be dealing with over that multi-day recovery process and site reclamation and dealing with all of that. So she's my balancing act, so to speak. So I'm blessed and fortunate to have her, and you know,
She's a
but
good woman.
she's a good woman, absolutely. Yep,
And
no doubt about
Tiger,
it.
and I just want to jump in here, and as you're telling that story, so not only are you responsible for this recovery, but what you just said is you're responsible for taking care of your son right now as a single dad, as she's gone out of
Right,
town. So you've got to
right.
meet the needs of your community, plus worry about your son at home.
Yep, yep. And he was 16 at the time. He was relatively self-sufficient, but we're close, and he can sense, emotional shifts and things of that nature. And I mean, it's certainly one of those defining moments in your career. You remember what you were doing when he and I were watching the movie Eagle Eye. And my pager at the time went off probably a couple dozen times a day and stuff like that. And Lori and I have always, and even to this day, he's 27 years old, we don't swear in front of our children. Not that we swear a lot, but it was always something we agreed on. And when my pager went off and I looked at the message, I shared an expletive. And he could certainly sense that something was wrong. And he said, "Dad, what's wrong?" And I said, "I can't believe it, but I'm going to a plane crash." And my wife was already asleep at the time, and I said, "Tell Mom I love her, and I'll call her as soon as I can once I know, what's going on." And I grabbed my personal go bag that I had keep by the door, and like I said, I was gone for the first 24, 30 hours or so at the crash scene, and then actually didn't see her for a week, which was probably a good time for her to be away in a certain sense. So, those are, it's about balancing act. And if you're not personally prepared for those types of responses, and your family is not prepared, other instances during, we had a surprise October storm. I don't know if you're aware of this, but we get this thing called snow in Buffalo.
We get a little bit in Cleveland.
A little bit, yeah. But October 13th, 2006, we got 2.5 feet of heavy, wet snow while the leaves were still on the trees. And it was like a scene from a movie. As literally as I'm pulling away from my house, the lights are going out in the neighborhood, and power lines are going down and everything. And I'm driving away from that to go help other people.
Mm-hmm.
And as I say, I was going on a red lights and siren guilt trip, because that's basically what it was. And I was gone, I don't know, I didn't come home for another 3 or 4 days initially and stuff like that. So, but organizationally, I don't think that a lot of entities are really looking at that far-reaching impact, or the impact of how much the family means to the responder, and therefore how much the family means to the organization. I can tell you from experience, I had a fire instructor who worked for me who was on military deployment for 18 months, and we were communicating online, and I said, "What can I do for your family while you're gone?" And just the fact that I reached out and asked put him at such ease. And he had young children at the time, and his wife. And I smartly stopped by his house and dropped off flowers for his wife, and Nick Charlap's ice cream gift cards for his kids.
So I think,
Candace knows all about Nick Charlap.
Yeah. So I think you just said something really important, that, as an organization, it's important that we take care of one another and take care of one another's families. It's so important. And I know when my husband was hospitalized with COVID, I had all of his coworkers at the hospital reaching out to see what we needed. I had all my fire and EMS friends from across the country sending text messages, shipping things, gift cards, food, this and that. And those little things, the little texts that I would get, and I didn't always get a chance to respond to all of them, but they meant a lot. Just knowing that, and my coworkers at work, the same thing, that there were so many people willing to step in and help. And I think what you just said, Tiger, you reaching out to that individual, that makes a huge difference. And that's something that we, whether you're in a leadership position or just, an entry level position, we can all do that to help one another out.
Yeah, absolutely. And it's, I think it's especially relevant during this current disaster. You know, a lot of people have asked me if I miss being in emergency management or in the middle of this, and I'll tell you, if there's one to sit out, I think this is the one. And partly because, you know, we as responders, we thrive on the adrenaline rush, we thrive on the rushing in and you know, making a bad situation better. The harsh reality is, and it relates in so many different ways, it relates right now to volunteer recruitment and our ability to reach out to people and get them engaged in a situation that is not a very healthy or safe environment to even come into, or even for us to allow them to come into. But it's, you know, as I've said since it started, there's nothing fun, exciting, glamorous, or short-term about this disaster. And it kind of goes back to that earlier statement that we in fire and emergency medical services, you know, we're good for the sprint, but these long marathon events have, you know, enormous, you know, impacts on us. I think of it when I think of, you know, the deaths and also just the uncertainty of, you know, every EMS responder who goes on a call, the danger they're putting themselves in through potential exposure, you know, is enormous, and that's got to weigh on people. I correlated to it's like a never-ending opiate epidemic. You know, you think about the overdoses and the fatalities associated that we've seen in our own communities due to the opiate crisis. This is yet another, you know, killer of that magnitude, if you will, that is going to be around for who knows how long. So
that's like the new normal.
Yeah, or actually, I prefer the new abnormal.
Yeah.
Okay.
Yeah, I definitely think that's a more appropriate term for it.
I want to circle back to something that you mentioned a little bit ago, Tiger. You brought up your go bag at the door. So I want to, you know, as we talk about this personal preparedness and we talk about go bags, what are some good things that EMS professionals can have in their go bag? And should they have a go bag for their family member? Should they have one for themselves? You know, talk about the go bag, because we hear the term a lot, but not everybody knows, especially those people new to emergency services. And so let's talk about the go bag.
Okay. First and foremost, your favorite snacks. Okay.
We always have to have food, don't we?
That's right. Right. And, you know, hopefully dry goods that have some shelf life to them. But, you know, Candace will tell you, I'm big on comfort foods. And, you know, your favorite snack is your comfort food, right? It's your go-to thing when you just need a little pick-me-up or something, like, you know, whatever it may be. Mine happen to be nutty bars. So I call them energy bars, but I'm sure there's some, you know, actually health value to them. But there's that. There's things that you have to anticipate that aren't necessarily going to be available in the environment that you're going into. You know, as crazy as it sounds, toilet paper, right? Basic healthcare items or bath items and things of that nature. A towel, certainly change of clothes, and from head to toe, I'll just leave it at that. And, you know, a key is as many good comfortable pairs of socks that you can fit in there, because I don't care if you're on your feet for long hours, or even worse, you're sitting at a desk in an EOC for long hours. You know, your feet need to be comfortable. Certainly any personal medications or healthcare items that you need. It's something I've struggled with my own personal doctor. He doesn't understand when I go to him and I say, I need you to double my prescription for the next 90 days so that I can have basically 30 to 60 days in reserve where I may not have access to them. So, you know, talk to your doctor, talk to your healthcare professional about that, to say, you know, how can I, you know, rotate the stock through, but so that I have at least a week's minimum, you know, of that type of stuff, because you don't want to find yourself in a situation, you know, Dr. Turner, I'm sure there's times when he hasn't just deployed by, you know, motor vehicle. Maybe he had to get on a plane and go somewhere and for long periods of time. And, you know, I was in similar situations. So, you need to have those types of things. I also am a big on something that gives you enjoyment, whether it's something to listen to, or a book to read, or a magazine, or something of that nature, so that when you do have some downtime, you can actually truly relax. And maybe it's something, I'm of the, let's say, life experience level, that it doesn't take me long to read a magazine or a book, and I pretty quickly doze off to sleep. So I call them sleep aids. I don't necessarily read them all, but they're good sleep aids. So things along those lines are important. And then the more obvious stuff, a flashlight, and hand crank radio, and different things, and or spare batteries or boosters for your cell phones and technology and things of that nature. So
Yeah,
whoops, I'm sorry. Go ahead.
I was gonna say, yeah, I think you brought up some really important things for the go bag, and I want to circle over to Alan real quick, and then we'll have some more questions for you, Tiger. So, Alan, what kinds of things do you recommend that individuals put in their go bag? And let's also talk about a go bag for families as well. So that's something, and pets, because I know, Alan, we all share the love of dogs here. So.
I think Tiger pretty much covered it. One thing that I do have in my go bag, especially before, when I was always responding to different state EOCs or FEMA JFOs, was an extension cord and an extra power strip, because you always run out of, and I can almost say this with pretty confident that every place I went to, we ran out of wall space or plug space to plug in your computer. I know it sounds a little trivial, but when you show up at 2:30 in the morning and they're asking you for a sit rep or to work on something, and your battery dies in your computer and there's no place to plug it in. But I do have an extension cord and an extra power strip. As far as the family goes, it was, your paperwork. We had and they're actually still in there and I retired back in 2010, but our plastic case is full of photos. And if you did have to evacuate an area, it is not going on a family vacation. It's a lot more stressful. You're packing up the dog. For some reason, gas prices skyrocket. I don't know if they put a hurricane additive in there or something, but they would pretty much double in price. The hotel rooms, they always seem to jack up the prices. So every time I evacuated, it probably cost between $500 to $700. And like I said, it was not a family vacation that we're going to go have fun in. And but the medicine was another one. My kids had asthma. They had to take the the albuterol and all that stuff. The medicine for the dog, dog food. And then the dog shot records. So it's the little things that will catch you off guard. But the biggest thing, like I said earlier, was being in financial distress during one of these things, not having the money, not having we're evacuating the house, and you always hear things can be replaced. Well, some things can't. If you don't have the financial means, and you can go to FEMA, you can listen to Brock Long talk about the different aspects of people being self-insured, not having enough insurance for their home. When me and Candace gave another presentation, the biggest thing was flood insurance that I kind of pushed during it, because most homeowners don't have flood insurance. It's just homeowners insurance. And if your house floods, you're pretty much, you're going to be hurting, because you pretty much lost your home. And flood insurance isn't that much, and you have to go through FEMA to get that. But I think definitely look at your insurance and your finance. Make sure you do have a backup plan. And like I said, I think Tiger pretty much said it the best. And especially having a attention deficit, because we definitely have disaster amnesia, collecting lessons learned, but also applying those lessons in a structured manner to change behavior. Because it's hard to plan or build a kit when there's blue skies out and it's sunny and it's nice. Nobody's going to be sitting in their living room, putting together a kit when, it's like the roofer with the leaky roof. If it's not leaking, but and I think also from a leadership standpoint, how can emergency response agency leaders be assured their responders are able and willing to report for duty during a disaster? And how can they ensure or assist the responders' family and that are safe during the disaster? Mm-hmm. And you also have to remember, being prepared is different than being ready. You can be prepared, you can have plans, you can have all these functions, everything's ready to go, but once it hits, same thing with the pandemic. There's a lot of people who had pandemic plans but did not see this magnitude coming. So
yeah, absolutely.
Sure.
Wasn't it your dog that took off when you evacuated at one time?
That was my dog. That was it was Hurricane Floyd. It hit the East Coast. I was living in Virginia Beach at the time, and we evacuated because Floyd was just kind of hanging out there. I believe it was a Category 4. And by the time I got home from work, we had everything ready to go. We kind of got out of town a little bit late. We went to a hotel or a motel that was at the hour. And when you have two little kids, it's a little difficult to explain why there's mirrors on the ceiling and the bed shaking apart and your dog's running around in the hotel room.
Oh, goodness.
And your wife is like, aren't you a emergency planner? I was like, well, for my job, yeah.
It's a little different, huh?
That's the easy part. I can't find a diaper bag, but that was easy. So.
Yeah, nice. Well, Tiger, you talked a little bit about individual preparedness. What advice would you give the leaders of EMS organizations for preparing their teams and their members?
I think open, honest discussions, realistic expectations. Everybody needs to know their limits. To say, yeah, I can respond to calls all day long. Mandate me for overtime, whatever you have to do. But if you're talking a major disaster where I have to physically be away from my family for long stretches of time, not just the difference between being work and being at home, but being long distances and stuff. They may have small children. They may have family members that have unique needs themselves, or other people that they're caring for. And it's funny. Candace was there. I want to say 2 or 3 years ago. She facilitated a panel discussion for the National Volunteer Fire Council in Arlington, Virginia, on just a tiny little quick subject titled the sustainability of the volunteer fire service in the United States. Just a quick 5-minute conversation, right? And I don't know if you remember this, Candace, but it was like as soon as the discussion started, somebody at the back of the room stood up, pointed literally at me as if he was calling me out, and he said, "What's the number one challenge of leadership today?" And I don't know if he was trying to stump me or catch me off guard or what the case was. And I kind of chuckled and I said, that's easy, getting to know your people. Because until you truly get to know your people, you'll never know their knowledge, their skills, their abilities, their experiences, most importantly, their interests, but also the challenges that they face at home. And the obstacles that they have to overcome to come to work every day, and especially in a long-term disaster or emergency situation. So you want to be a real leader, get back to what fire and emergency services and public safety was built on, and that was taking care of each other. That's the brother and sisterhood that we speak of so frequently. That was the foundation of these organizations, and that's the real challenge of leadership today. So then there's the physical plant part of it. How do I physically take care of their families, and manage the disaster and manage my employees or volunteers, and manage all of our resources and, in our business all at the same time, right? But having a dedicated either team of people or just an individual who's, the chief check-in officer, so to speak, or the chief, what another term we use in recruitment and retention is the chief people officer. And that's one that's going to make that personal connection with the families to make sure that they have what they need. my own volunteer fire department, we've looked at building a cache of, dry goods and canned goods and capabilities to house ourselves, and take care of our families in times of disaster while our responders are out in the street taking care of each other. But think of the situation with the pandemic where we had fire stations closing down to anybody but the responders when they came to the station to respond if they were home response or those crews on duty. So they took a different approach to it where they actually isolated themselves because of the risks of bringing outsiders, so to speak, into those environments. And I've talked to a lot of fire chiefs. I just wrote an article about it recently. And I'm actually going to be doing another webinar soon about coming out of crisis with successful recruitment and retention solutions. But I've talked to fire chiefs. One fire chief who told me, I lost 6 firefighters, 6 responders, and EMTs to the virus. They didn't catch it. They just made the conscious decision that they would not respond because of it. And the anecdote, the explanation that one of his EMTs gave him was, a firefighter EMT says, something goes wrong inside of a burning building. I have more control over the outcome there than I do going on an EMS call. I get hurt in a burning building, it's me. Does it impact my family? Absolutely. I go on an EMS call and catch the virus, I could potentially bring it home to my family. That's a tough pill to swallow. It really is. And a lot of people have had to make very difficult decisions on top of the organizations who have been, directly affected by, and in some cases riddled by the virus physically, where their members were taken offline. So that's, that has both, the physical and health implications, but it also has the mental implications of it as well. That's the fear factor, if you will, as to what am I putting myself, into, and what's the right decision for my family. So again, I think open and honest conversations from the top of the organization down to the lowest level, and staying in communications with their members and their support system throughout all of it is going to, certainly make things a little better. I guess that's the best we can hope for. One analogy I'll share again is during Hurricane Irene, we were deployed to Schoharie County in southeastern New York and went into the small little village of Schoharie. And I had brought 18 units with me, over 100 firefighters and EMTs just from my county. And somebody asked me, oh my God, did you leave anybody behind? We have 8,000 volunteer firefighters in our county. We didn't they didn't miss 100. Let's put it that way. But after a very short conversation where I was able to share with the chief and build that rapport and confidence as to what we had brought, how we were self-sufficient, and how we were going to help them, he literally reached across the table and went like this. And I said, what's that? He says, it's the keys to my fire department. You're it. And what was supposed to be a 72-hour deployment lasted for 2 weeks. And we ran their fire department and eventually were given charge of their entire county. But Marty Pierce, the chief of the Village of Schoharie Volunteer Fire Department, I credit him with being a transformational leader, because he knew that until he could get his members' lives back in order, they could not get their community's lives back in order. And that takes tremendous resilience. It takes tremendous leadership. It takes tremendous discipline to hand over your entire community and your operation to an outsider. And I think he's just a tremendous leader in that regard. Virtually every single one of his members had lost their homes to the hurricane and to a flood that just ravaged their entire village. So I tell that story all the time as to, the mentality that a true leader needs to have, because he knew his people. He overcame that challenge, and he knew how to take care of it, and he knew that he had to take care of them so that they could eventually get back to taking care of their community.
Wow. That's amazing.
Yep, really was. It was one of the best deployment experiences I had ever ever had. That's for sure. So.
Awesome. We should all be fortunate to be able to work with a leader like that. That's really amazing. Really amazing. Yep. Thank you, Tiger. We really appreciate you being on the show with us today.
Absolutely.
It's awesome to hear from you
My
as
pleasure.
well. Yeah. So we're going to move on to the resource wrap-up portion of the show. We're going to offer you guys your final thoughts or tools for addressing our EMS personnel preparedness.
Yeah, so let's talk about what you can do as an individual. One, we know it's important to educate yourself on what you can do to prepare your family. Look for the different workshops. I know FEMA offers them. There's different guides and things online. As an individual, we have a personal responsibility to research those, find out what resources are out there so that we can implement them with our own homes. If you visit the FEMA site, ready.gov, and search for the Ready Responder document, there are some really helpful tips that can help you in preparing you and your family. Talks about the different things that you need to have in your go bag, conversations that you should have with your family. And when it comes to those conversations, it's so important to have the conversations with your family, to make a plan, to practice your plan, and to talk about that plan all the time. I always had a plan in place with my kids and my extended family members in the event a disaster occurred in my own community. You know, I knew that I could not be home to care for my family if I was running EMS calls. So this plan included basic things like simple things to do during a power outage, because if I wasn't home, you know, my kids needed to know what they needed to do if there's a power outage, because both my husband and I both were running EMS at that time. And I didn't want that stress and that anxiety of what was going on at home to impact how I was serving the community. So it's really important to talk to your family, have a plan, talk to your extended family members, because if you're not going to be home to help your family, who's going to be that backup provider? And as an individual, if there's some struggles and you don't have somebody at home to be a backup provider, talk to your leader, talk to your supervisor and say, hey, you know, I'm a single parent, or I'm taking care of my elderly mom and dad. Here's what I can do, but this is what I can't do because of this situation. And together you can start to brainstorm some of those solutions.
And we need to do that with our staff as well. You know, make sure that they are prepared and they're able to take care of things at home while they're at work. I mean, if I have staff calling off, I can't run the emergency department by myself. And we're trying to build a plan at the hospital that we have resources available for people. Just like Candace said, the ready.gov responder ready documents, you know, things that are available for them. And we do drills, like I said, and everything that the staff could prepare for before this pandemic, we kind of ran through. So it was a great learning experience. And then we were like, oh my gosh, it's really happening. So just being prepared, like we've said, is all we can do.
Yeah, absolutely. So we want to give our guests a final opportunity to share any last words of wisdoms that they might have with our listeners. So we'll go ahead and start with you, Alan. Is there any final words of wisdom you'd like to share?
No, I appreciate being on the podcast. And, thank you. And like I said, and you know, I'll reiterate what Tiger said. It's, you know, the attention deficit. Don't have disaster amnesia. Practice. Be prepared. You know, be prepared through insurance, financially, and make sure your family's taken care of so you can do your job.
Yeah, absolutely. Thank you, Alan. Thank you.
And you can actually do a debrief with your family to let them know what you've been through, and they can keep an eye on you too, because it's, you know,
I think that's really important. People that don't do what we do don't understand until you spell it out and show them. And even my own mother, I showed her a picture of a trauma room one day that was just a disaster, messy, everything. And she said, you really do that? I'm like, I work in the ER, Mom. What do you think I do? But they just don't get it.
It's kind of that thing where you share, but you don't scare.
Yes.
You know, that you want them to know that, hey, I'm not out there playing golf. You know, I'm dealing with this stuff. And when I get home, I'm probably going to need a little downtime. So,
for sure.
But thank you very much. I appreciate it.
Yeah, thank you. So, Tiger, what final words do you have for our listeners?
I'm going to kind of play off of something that Alan said, and and Robin, you touched on it. Our families just don't understand. They're not the ones there. They're not seeing what we're seeing. They're not the ones exposed to what we're exposed to. And I can tell you on more occasions than I could count, my wife, Lori, always asked me, why do you always have to be the guy in charge? Right. And I took that as both a compliment and a concern. And, and it was genuine. And it leads to something that, I've written about often, and I create these memes about things like this. And if you know any real, firefighter, EMT, police officer, public safety professional, we're not the ones making the real sacrifices. It's those who, don't get up in the middle of the night, the ones who don't leave the dinner table, but the ones who we leave behind. Every time this thing goes off, offering us another opportunity to go and do what we love. And that's both a blessing and a curse, I guess, is the best way to put it. We have an obligation to get right with ourselves, get them right in our absence, look out for them, and make sure that we have a support system that is looking out for them as well. And that's something I've always been blessed with, whether, I've been on a county deployment, state deployment, or whatever the case may be. My own volunteer fire company knows that I'm on loan to the bigger world, so to speak, and they make sure that my family is checked in on frequently and taken care of. And that means the world to me. The other side of that equation is, again, we as the responders, we need to remember to clean the litter box once in a while. We need to debrief and diffuse ourselves. I've never been one, and it bugs the daylights out of Lori that, I maintain confidentiality. I don't tell her about any calls I go on. I don't share with her, I don't gossip. And she typically finds out about a lot of the things that I've done or been exposed to from other people telling her. And maybe I need to get better at that, or maybe I need to figure out a balancing act as to what's good to share. And, she knows when I actually share something with her, that there was a reason I shared it with her. And either it's to watch out for me, or most often because I knew she was definitely going to hear about it from somebody else if I had a close call or something of that nature. But I think the greatest gift that we carry as responders, though, is what I call the gift of perspective. And I've again written this out and created memes around it. We're not guaranteed of much in this business, but the opportunity to encounter someone else every single day who's having a much worse day than we are. Mm-hmm. That is not a burden, it's a gift, and it's called the gift of perspective. And whenever I think I'm having a bad day, or I'm up against obstacles or challenges or whatever the case is, this thing goes off and reminds me, you know what? I'll be honest with you, my day doesn't suck quite as bad as I thought it did, right? And sometimes that's what it takes. And the reality is this is going off constantly for a lot of people, especially in the EMS world, and it can be overbearing and just sometimes come like a deluge. But we all have to be reminded that we've been given this gift of service, and that truly is a blessing to us. And when we lose our caring and compassion because of everything that we're carrying, it's typically time for one of two things, as I say, either a boot or hopefully only a reboot. But whatever it takes, you need to go in the right direction to keep you right and to keep your family right.
Absolutely agree, 100%. So, kind of the end of our show. We really want to thank you both again for being guests on our second show. I'm Robin Goldinger.
And I'm Dr. Candace McDonald. Thanks for listening to Another Dose. See you next time.